The urine and stool of a patient receiving chemotherapy can be very irritating to the patient's skin. Cleansing the skin and applying a protective cream is very helpful. If a chemotherapy spill should occur, it is to be cleaned up by specially trained personnel, usually a nurse. The side effects of chemotherapy occur because chemotherapy not only kills cancer cells, but kills normal cells as well, cells that are rapidly reproducing in the body, such as those in the bone marrow, the mouth, the gastrointestinal tract, hair follicles, and skin. The most common side effects for patients receiving chemotherapy are nausea, vomiting, hair loss, which is called alopecia, a decrease in the patient's blood counts, diarrhea, constipation, mouth sores, and sometimes skin problems. Loss of appetite and fatigue are two other major side effects. Each patient responds to chemotherapy differently. Some patients may experience many of the side effects, while others experience no side effects at all. Another common method to treat cancer is radiation therapy. Radiation therapy kills cancer cells through the use of high-energy ionizing radiation. Unlike chemotherapy that kills normal cells as well, radiation therapy primarily kills cancer cells in the area that radiation is being given. How is radiation therapy given? The total dose of radiation needed to kill the cancer cells is divided into small doses to prevent life-threatening side effects and even death of the patient. It is usually given 5 days per week for 25 to 30 treatments. Each treatment usually lasts only a few minutes. Radiation can be given internally or externally, like X-rays. There are no special precautions for patients receiving external radiation. Precautions to be used by healthcare workers for patients receiving internal radiation include the use of a lead apron and limiting the amount of time spent with the patient in close proximity. Surgery is another means of treating cancer. Surgery can be used alone to cure cancer, or it can be used with other cancer treatments such as chemotherapy, radiation, or biotherapy. A newer method of treating cancer is the use of biotherapy. The biotherapy is the use of agents that are biological, which means similar to those found in the body. Biotherapy works by enhancing the patient's own immune system and sometimes by stopping the growth of blood cells and blood vessels that feed the tumor. Biotherapy is given similarly to the way chemotherapy is administered, usually intravenously or subcutaneously, which means under the skin into the fatty tissue. There are also similar precautions and side effects with biotherapy as there are with chemotherapy. When a physician determines that nothing more can be done to cure the patient with cancer, palliative care plays a role. Palliative care is providing care and support to patients who are near the end of life. The goal of palliative care is to make the patient more comfortable and improve the quality of life for that patient. Hospice care is an organization that provides palliative care and other supportive cares. It can be used within an institution such as a hospital, a nursing home, or a freestanding facility, or hospice care can be provided within the patient's own home. The goals of hospice care are the same as palliative care. patients with cancer have many emotional and social needs. Many patients experience emotional distress and anxiety. This may be related to just receiving the diagnosis of cancer or be related to the treatment required. Some patients actually experience depression. It is not uncommon. This can be due to difficulty coping with the cancer diagnosis and the treatment. Cancer patients also experience a feeling of loss of control, primarily due to lack of knowledge about care and treatment, or they may need extra help in doing their activities of daily life. Grief is another emotion that patients experience due to the diagnosis of cancer, sometimes a poor prognosis, changes in body image, loss of hair, weight loss, all contribute to feelings of a sense of grief and loss. There may be family issues, such as changes in the role in the family of the cancer patient, or relying on family for some or all of their care, which adds an additional burden to the family. There may be financial issues. The cost of cancer care may be covered by the patient's insurance, but not all treatments are covered. Now we will listen to a patient share his experiences and feelings about cancer care and treatment. We can learn from this patient how we can best meet the needs of our patients who have cancer.
Mark, I'd like to ask, what's prompted you to use the healthcare system in recent times?
Well, in the last recent times, I would say in 2002, I was a victim of a heart attack right on this living room floor. The second time was, of course, when I was diagnosed with this multiple myeloma.
So multiple myeloma, just for the audience, is a form of cancer?
Yes.
Okay.
I was diagnosed, I think, December 6th of last year.
Okay.
After a couple of other diagnoses that turned out to be false.
You've had, I'm sure, a lot of experiences with caregivers with these health issues that you've talked about. What would you say might be some situations that you felt did not go very well?
Well, one of the first things I remember is the intensive care facilities at the hospital and the hustle and bustle of everything going on in that facility is just astounding. People in and out constantly, putting in needles and checking temperatures and pulse ox and wheeling these little machines in and out constantly, taking all sorts of various readings. I found most of them to be personable, especially the nurses. Some of the others that were just doing readings were not quite so personable. They would just come in and take their readings and leave. Oftentimes at all hours of the night, which I'm sure is necessary. But I would say, as a general rule, most of the meetings I had with various caregivers was positive. I did have a rather strange one with a nurse that asked me what I had, and I told her multiple myeloma, and she said, oh dear, that's terrible, oh dear. And I thought that was an interesting